All right, we are happy to have in the studio here with us this morning Dr. Cliff Connery, who is the medical director over at the Dyson Center Cancer Care at Vassar Brothers Hospital. Good morning, doctor.
Good morning, Mark. How are you today?
I'm doing great. So, first of all, let's get right into this. Tell us what the role of screening for lung cancer does and what kind of difference it makes.
Lung cancer, as you may know, is the most significant problem for our country as far as cancer is concerned. It causes more cancer fatalities than the next three cancers combined, both for men and women. It's a real significant problem, and overall, the survival is only about 17% for people who are identified with lung cancer at 5 years. Now, clearly we have found that if you can find lung cancer early, it is curable. And that's where screening comes in, is to try to identify a patient population that is at higher risk, screen and identify them, and find the cancer early. The real problem is that lung cancer, when it's early, has no symptoms.
Okay.
So when you think about it, the way the original equipment is made, we have much more lung capacity than we need to do the average things during the day. You know, we have enough capacity if we were properly trained to be doing the Tour de France, for example. So if you're going to get a lung cancer that's going to cause you to be short of breath, you probably have lost more than half of your lung function because you need less than one good lung to be able to do the things that we normally do. So getting symptoms of shortness of breath isn't good enough. The lung has no pain fibers, you're not going to have pain. So that's a real problem for us. So by the time it's symptomatic, many times it's advanced, and so you can't wait for symptoms if you can avoid it and have an excellent test.
So then, now, what are the services that a comprehensive cancer center provides the community?
Well, what a comprehensive cancer center provides the community is complete treatment from prevention through the more advanced stages, supportive care, and survivorship. And that's what a comprehensive cancer program has to offer you. One of the things is to be able to, well, if we had a medicine that could help prevent the cancer, geez, that'd be great, get the proper people on that. But we don't have that for every disease. Having screening programs in lung, colorectal, breast, other diseases where you can be effective in identifying cancers early. But importantly, once you find a cancer, make sure that you treat it effectively. That's the real thing that a comprehensive cancer program can have. To make sure that it's a multidisciplinary approach. For many of us, if you have a cancer, unless it's the earliest tumor, usually the treatment is from a variety of disciplines. We've all gotten better. The medical oncologists have gotten better, the radiation oncologists have better devices, the surgeons use minimally invasive robotic techniques when appropriate. But putting all these things together, recognizing the strengths of each discipline, that's the way that we can treat people effectively. Talk together amongst the specialists, treat patients effectively, and then have all the other support, nutrition support, pain management, rehabilitation, find out ways to get people for transportation back and forth, and other things for survivorship. These are the things that a comprehensive cancer program can do.
Okay, you bring up transportation, and I guess this is a question that some people have. Why is it better to stay here in the community than to travel outside the community for cancer care?
Well, I think the first thing boils down to quality. If you provide quality care, has state-of-the-art treatments, innovative treatments, and the ability to participate in clinical research, then you should be able to stay locally. And you know, it's difficult. You get a cancer diagnosis, your family's worried about you, people have jobs. You should be able to work while you're getting treatment. It's not the end of the world if you get a cancer diagnosis. Our challenge is to be able to provide treatment in a way that will allow people to live their lives. Albeit there may be a day when they say, hey, look, I know the fourth day after I get chemotherapy, that's not a good day for me, I want to work from home.
Right.
But you should be able to provide the ability for people to be at home and be treated effectively. It's much easier than trying to find parking, family members coming all over the place, back and forth for tests. And so, but at the very beginning, you have to have the quality. And that's our job, is to make sure that we can provide people in the community quality care.
Well, certainly the Dyson Center's been here for quite a few years now, so we know about the quality.
Yeah, well, that's one of the reasons why I came here, is that the administration has decided to invigorate even further, to increase the depth of the programs that they have and to add on to the quality of care that they have already provided here for the community. And that's one of the reasons why I came here from Manhattan.
Right,
Was
you
it
came
this?
from, yeah.
Yeah, so I was working down there for 22 years. I'm not a city boy, I was kind of a country boy, so I was going to Manhattan under duress a little bit over all these years. But
Okay.
but so now there's a chance to come here and be part of a reinvigoration. It's not a startup, but it's a re-emphasis on the cancer program. And so at this stage in my career, where I'm looking for another challenge, this was real exciting to me, and so that's why I came here.
Well, and coming from a big medical center down in New York to Vassar Brothers Hospital, how do you compare the level of care between the two?
You know, of course, you know, we in order to be successful, you have to make sure that your care is excellent, to figure out a way to make things work. And so we were proud of the level of care that we had in my hospital in Manhattan. But one of the things I did find here is that it was a little bit easier to get the program started. Excellent nursing care. I was really astounding nursing care. The patients are up and moving around right after surgery with the proper support. Programs are resourced very well as far as the services that they need, the proper people to help us with data management so that we can properly track our outcomes. But particularly on a personal level, when you come here and are treated here, you can actually sense the level of caring and the level of interest, and it's genuine. And I've had a fair number of patients who have traveled to follow up with me from Manhattan and from other places in the area where I was treating them, and they are willing to make the trip to come here. They're very satisfied with the level of care, but also the quality of care, from radiology to all the other aspects that my patients need when they come here. So for them, it's been worth the trip. You know.
And what about innovations for the future here in the Hudson Valley?
Well, I think that's really an exciting thing for us here too. We have all of the latest technology as far as from the surgical world, the minimally invasive surgical techniques, the robotic technology, other tools that help us do minimally invasive identification of tumors, sort of like GPS mapping to be able to find areas that we can biopsy that we wouldn't have been able to access before. And the institution is committed to updating and critically evaluating new technologies as we need them. But more importantly, it's not just the bells and whistles, it's the people who use them. And so you have to know when to use these technologies. And the concept here is getting people together to look at things as a group in a combined conference, so we work together as a team, and we identify when we should be going one way versus the other. At the end of the day, treatment is becoming more and more individualized for patients. And so you take a look at their performance. You know, some 80-year-olds are in much better shape than some 60-year-olds or younger people.
Right.
And so you have to look at everybody as their own book and to tailor a treatment plan that's going to be effective for them, to give them the best combination of quality and time.
Well, it's terrific having you here this morning, Dr. Cliff Connery, who is the medical director at the Dyson Center for Cancer Care at Vassar Brothers Hospital, doing great things over there, and we appreciate you stopping by to talk to us.
Thank you very much, Mark, and be glad to help you guys with any other discussions regarding this as we go forward, because at the end of the day, education is important, not just for other clinicians, but for the public, et cetera, to let them know what the options are. And that's one of our roles, is to be educators as well here.